Welcome to Aging Well with your co-host Alice Liu. For years, Rebecca Lynn Lyons was told that her pain was normal. However, after nearly a decade of searching for answers, she was finally diagnosed with endometriosis, stage 4. Now she is transforming her painful experience into innovation through the creation of Hersay, an AI-powered health companion helping women navigate healthcare with clarity, confidence, and a stronger voice. Today we have with us the co-founder and CEO of Hersay. Welcome to our show, Rebecca. Thank you so much for joining us today.
Thank you, Alice. I'm so excited to be here.
So for our first question, tell us more about how your personal health journey led to the creation of Hersay and how it may have influenced its mission and business model.
Absolutely. So I think, like a lot of women, I spent many years going to appointments, describing my symptoms, and then leaving without answers to what was going on. I was dismissed. I was told it was stress, told to come back in 6 months if things didn't feel better, which I did, but then still didn't get answers. What I didn't have at the time was a way to clearly explain to my doctor exactly what was happening to my body over time, such as like the patterns that were going on, the connections, and really like the full picture of how those symptoms were maybe fitting together. So it was really that experience that led me to do something about it. I thought, all right, with the change in primary care provider, I finally was able to get the answers that I had sought for so long. And I wondered how many other women went through a similar experience. So I spoke with 112 women across North America and found that 89% of them felt dismissed or unheard by their healthcare providers. The number unfortunately didn't surprise me because it was representative of my experience, but it really did inspire the reason why we created Hersay. The reason that Hersay exists is because no woman should have to walk into a medical appointment and feel like she has to fight to be believed. The healthcare model is built around giving women the tools to show up prepared, informed, and confident with Hersay. So I think that there's so much that we can do to put the power in the patient's hands and have them be an informed participant in their care journey, an active participant in that care journey, with the idea of ensuring that the doctor-patient relationship is something that's built on an element of trust.
Wow, what a powerful story. And I really like the part you were saying about how what you're trying to do is bridge that gap between what people feel and what the doctor is trying to understand, rather than, for example, trying to replace that doctor altogether.
Exactly.
So, for viewers who may not be familiar with Hersay, can you speak more about how exactly the platform works?
Absolutely. So Hersey is a companion app. It's available on the App Store and the Google Play Store. Women use it to track their symptoms day to day, and that could be mental health, physical health, anything like pain, fatigue, mood, sleeps, cycle changes, brain fog, anything. And the app helps to identify those patterns over time that can be really easy to miss in the moment. An example, someone may be receiving some feedback from their body that looks like headaches, right? We can sometimes not see that there may be a pattern with those headaches. They may actually be cyclical. So the app can help to identify that they're happening cyclically, or perhaps along with another type of trigger, right? What makes Hersay different than just a symptom tracker is we generate a clinical report. So just a really clear, organized summary of the health data that you've input that you can take into your doctor's appointment and get the most out of that 10 to 15 minutes you have. So instead of trying to remember everything you've experienced, you walk in with that evidence, the data. It doesn't replace the doctor, it's non-diagnostic, but it simply helps you to get more out of every conversation with your care provider.
Wow, that sounds incredibly useful. I would like to use that myself. So, what would you say are the biggest current gaps in healthcare for women?
Yeah. The gaps for women in healthcare, they're very significant. They're really systemic. So historically, right, medical research was conducted on male bodies. So for a long time, women's symptoms were either like understudied, they could be dismissed as emotional. We didn't have the data, unfortunately, and we still don't have that data because up until around 1993, that data wasn't available to us. So it has real consequences today. It looks like women waiting longer for diagnoses. They're much more likely to be undertreated for pain. We've got conditions like endometriosis, perimenopause, autoimmune disorders that often take a very long time to identify because the criteria as to how these get diagnosed can be either ambiguous to doctors, they may not be up to date on the latest research, or the research doesn't exist. There's no cure for endometriosis at this time, unfortunately, as an example. And hopefully over time we'll get there with more funding into this women's health research, but we've got a long way to go. I'll also say for women in midlife, especially, it's really critical. The perimenopausal and menopausal transition in life is one of the most medically significant chapters, but it's also the most wildly underserved. We don't have a lot of information about perimenopause and that experience and how we can support women through that experience. Many women reach that stage even without information. They may not have support. They are not expecting to go through that experience. And if the care team isn't aware or they don't take the concerns of the symptoms seriously, sometimes we have women feeling very unwell for quite a long time, right? Brain fog, a lot of fatigue, pain, other things that flare up. So I think really that's the gap that we're trying to close, not just with technology, but also by helping women build the language and confidence to advocate for themselves when it comes to their care.
And I can see how technology can play a part in making that easier.
Absolutely.
But speaking of which, how do you balance technology with also empathy and human-centered care?
Yes, this is a really good question, and I think about it all the time. So I think technology by itself can feel really cold. Um, Whereas health is something that's really deeply personal, right? From the very beginning, when we were developing Hersay, we wanted it to feel like a companion, not a clinical database. Like the language that we use is warm, the experience of using the app is intuitive, and the whole point is to make women feel supported. So we're not trying to position Hersay as a replacement for a doctor as well. We're here to strengthen that patient-provider relationship rather than work around it. So when someone walks into an appointment with their report, their doctor simply has better information to act on. The patient feels more prepared. And that's really like the type of collaboration that we're building toward. So empathy isn't like a separate entity from the product. It's a part of the product.
That makes a lot of sense. And it is really interesting because, as you said, it is a tool to help you speak better with the doctor. But while using that tool, you can also feel a little bit, a little bit of warmth.
Exactly.
So, what has been the biggest challenge building a femtech startup?
Ooh, this is a really good question. Honestly, I think being taken seriously in a space that's been chronically underfunded and overlooked. I think women's health in general has received a fraction of the research dollars and venture capital dollars compared to other areas of medicine. And that tends to shape who gets funded and what gets built, right? As a female founder, I have to work extra hard to establish credibility in rooms that weren't built with me in mind. And that can be a challenge in itself, right? So not only are we looking at simply being a female founder, we're looking at being a female founder in an industry that we know has funding challenges. So um, I don't let it deter where we're going. I think we're really married to the problem, not the solution. And we have a wonderful user base. We have a wonderful community that supports us. And it's really what keeps us going. Um, it's all of the women who send us a message after using the app and they say, oh my gosh, my doctor finally listened to me. Or, oh, I finally got a diagnosis or an answer. Like that piece of it is not abstract. It's not something that is fictional. It's real, true information that keeps us going, and it reminds us that this challenge is worth every hard day.
It must feel so incredibly good to hear people say, oh my gosh, this really helped me in a way
Yes,
that you probably wish you had help as well.
absolutely.
How would you say that digital health tools empower women to become stronger advocates for their own health?
Like knowledge is power, right? Knowledge is the foundation of advocacy. If you look back at like empirically, like 3 months of your own health data, and you can see a clear pattern. Maybe that looks like, my fatigue, it spikes at a certain point in my cycle, or my pain correlates with sleep disruption, something like this. You can go into an appointment with something really concrete, and that in itself is really validating. So you can move and shift from like, I've been feeling kind of off, to here's exactly what's happening because this is what I've logged with what's going on with my body. And the confidence that you get in being able to speak intelligibly about what's going on can really change that dynamic of the conversation. If you're prepared, you're much more likely to ask follow-up questions or to push back if something doesn't feel right. Look for a second opinion. Just ask for what else could be done, right? So I think like when digital health tools are performing well, they can give people the information that they need to show up as full participants in their care rather than just a passenger.
That sounds really exciting. It sounds like with the future of tech, we can maybe move a little bit more forward in women's health in general.
Correct.
So, what advice would you give to female entrepreneurs entering the health tech space today?
Ooh. Um, I would say this is the advice I give to any founder, regardless of the industry. Um, Definitely start with the problem. Don't start with the product. I find many founders can fall in love with the technology or the product they're building before they've actually listened to the people that they're building that product for. In health, especially, that's really dangerous. Of course, you have to understand the lived experience of your user, the frustration, the fear, the workarounds that they're using before you build any features. If if you build something without speaking with your end user, you run the risk of developing something that isn't actually useful, that somebody will not pay for, or potentially does more harm than good, right? So I think it's really important to stay very connected to your customer, whomever that is, and not to underestimate the power of community as well. So those early users, they're actually not just a customer, they're your co-creators. They're giving you the valuable feedback you need in order to develop and bring a product to market that is needed in the world. So for us, all of the women who gave us their honest feedback and told us what wasn't working for them, they shared their stories, they really shaped Hersay into what it is today. So I think building with people rather than just for people can make all the difference in your success as an organization.
Wow, that's really good advice. Is this something that you had to learn during the process, or did you already have it in mind in the beginning?
Yeah, that's a great question. So, we're very, very fortunate to have received a lot of mentorship along the way. There are some wonderful regional innovation centers that we have across Canada, the Accelerator Center, Communitech, Innovation Factory, and others. And with the support of those mentors and going through some of the programming, we were able to uncover that go to market solution, finding product market fit before actually building something, understanding what the users are looking for and iterating on that before fully launching. So it was something that we didn't necessarily have in mind until we learned it. And it's knowledge that I pass on as much as I can to other founders.
I'm sure they'll appreciate it very much.
Yes.
So, where would you say Hersay and women's healthcare innovation in general is heading over the next 5 to 10 years?
Yeah, I think right now we're at this pivotal moment. There's like this real shift that's happening. People are looking for personalized solutions. They're looking for continuous health data to be available, wearables integration, right? All of these things, and how that becomes part of the standard of care. So right now, like, a doctor maybe sees you for 15 minutes, maybe a few times a year, maybe less. But I think we're building towards a future where the piece in between appointments, where the information exists in there, is just as critical as having that appointment itself. So I think for women especially, it's really transformative, especially again looking at perimenopause and menopause as an example. Um, Having these like really, really important health things looked at and understood, and a simple part of how care is conducted and received will really help how people are feeling. If we look at population level health and helping people feel well for longer, right? It's so important to address the holistic view of what we look for in that experience. So within the next decade, I think the idea of walking into a doctor's office with just your memory will feel like the old way of doing things. I think going in with no data or information will no longer exist, right? We're seeing these shifts already today, and I think it's just going to get faster, smarter, and more cohesive.
That's really exciting to hear. I mean, as someone who myself has had to walk into the doctor's office and just felt so lost, I'm really glad that we're going somewhere with this.
Absolutely.
What is your call to action for our viewers, especially women who may feel unheard or overwhelmed navigating the healthcare system?
Yeah. So first and foremost, I want all of the women watching to know that your symptoms are real, your experience is valid, you deserve a care team that takes you seriously. If you've ever left appointments feeling dismissed, it's not a personal failure, it's a systemic gap, it's not your fault, right? Um, I think also like the most powerful thing that you can do is to get informed about your health, get organized with your health, start tracking, write things down, bring notes to your appointments, ask questions. If you need a tool to help you do that, Hersay's here. You could use the notes app in your phone. You could write it on a piece of paper. It doesn't matter. But you don't have to walk into that room alone. You don't have to rely on anyone else to tell your story because you're the one who's living it, right? The doctor doesn't understand your experience. They don't live in your body. So it is up to you to explain that clearly. And you're also, again, allowed to and should be an informed participant in your care. So you're allowed to ask questions. You're allowed to explain if something doesn't feel right. You're allowed to challenge if something's not resonating and ask for additional opinions or different ways to diagnose. You do deserve better care. So please make sure that you're pursuing it.
That's incredibly good advice, especially the part about you saying that it's not our fault and also that we should speak up and challenge even the doctors sometimes. Maybe we could speak a little bit more about, um, so for your call to action portion,
Mhm.
you feel you saying that it's not your fault and that you're allowed to challenge the professionals. Maybe you could speak more about how your own experience might shape your call to action.
I founded Hersay after I had had my first daughter. Um, she was about 6 to 8 months old at the time, and navigating this care system while being a mother and trying to create a future for my daughter, a future in which I knew that she would have to navigate and exist in, also inspired me to make a change within the system. So we when we were going through this personal experience of course, the diagnosis was stage 4 endometriosis, I finally felt like I had been heard. And it was that pivotal moment of understanding that there was a different way to navigate care. And that way I felt was a much more informed participant in my care. It was collaborating with my doctor, asking more questions, understanding what that care journey looked like for myself was so important because now, of course, I have other lives to think about. I'm expecting my second child now in about a month's time. And I know that when I need to advocate for them in their appointments, that conversation is going to look different than if I was speaking only about my own health, right? I have to then be their advocate. And so I think with Hersay, there's so much that we can do to come in informed, come in understanding what we want to have a discussion about, and then, of course, follow up on what the outcomes were and see if those outcomes are working for us. And if they're not, go back and seek other answers, right? Find a better way, because we deserve to feel well. And as a mother, we tend to prioritize our health last, right? We have so many people in our lives that we take care of. But I urge people to reevaluate, because if the ship is sinking, it's really hard to take care of everybody who's on board. So it's really important to prioritize your own care as well.
That's so touching to hear. I'm sure your children will be very proud of you one day.
Thank you. We were doing our market research. We talked with, of course, the end user. We spoke with women who are navigating healthcare, and we also spoke with primary care providers, OBs, private healthcare providers, pelvic health specialists, naturopathic doctors, to understand what they were looking for in a patient-practitioner relationship. And that helped to shape how we created the questionnaire, how we created the components of our app to help serve the practitioner best in those moments. So I think every doctor who's serving their patients is doing so, I feel, from a genuine place of wanting to help. And we're able to support them best when we can provide them the information that they need to do their jobs efficiently, right? When we're navigating a system, as we do in the Canadian healthcare system, with so many limitations. Our doctors have limitations as to how they need to conduct these appointments, right? They have a framework that they follow. They have a way they need to bill for appointments. If we can fit into that model and support them with doing their job efficiently, of course, we make that transaction better for everybody who's involved.
That's really important and powerful to hear. I mean, it's not just us, the people going to the practitioner, who wants better service. It's also them who wants to provide better service.
Yes, exactly. Absolutely.
How can people learn more about Hersay and access your services?
For sure. So Hersay is available for download on the Apple App Store and the Google Play Store. You can simply search Hersay. You can also find us on our website at www.hersay.ca, hersay.ca. I'm also available on LinkedIn or by email, so feel free to reach out. But if you're a woman who's ever felt like you had to work too hard to be heard in a medical setting, the app was built for you. Give it a try and let us know what you think. Your feedback is how we shape the product, and we truly appreciate it.
Wonderful. Well, thank you so much for your time today, Rebecca. To our audience, thank you for tuning in to this episode of Aging Well. This has been your co-host, Alice, and the incredibly inspiring CEO of Hersay, Rebecca Lynn Lyons. Until next time, live long and prosper.